So good morning. I'm a postdoc researcher at the Faculty of Law of the University of Trento. And as mentioned by the introduction, the kind introduction, I will deal with a specific law topic that is the connection and the interplay between the data protection regime and the open data legal framework, trying to find a way for combining the need to foster scientific research by the use of health data in light of the CNEC center interest in the processing of health data. I will start with some introductory remarks, then I will move to the data protection framework. I know that maybe all of you are familiar with the GDPR regulation, but I will focus on specific concepts that are key for the scientific research domain. Then I will explain how actually the framework is not completely regulated by the European Union, but there is a lot of room for the national frameworks. So I will give some examples for Italy and France. Then I will move to the open data regime, focusing on the new legislative proposals and new regulations, meaning the Open Data Directive, but also the Data Governance Act and the Data Act. And I'll try also to illustrate some important strategies that foster open science and open data at EU level. Finally, I will try to investigate the interplay between data protection needs and the open science policies, finding maybe some conclusions. So I should start with some necessary definitions, and I will adopt an European Union perspective. When we talk about data protection, we should be clear that there is many room for national implementation. And here in the European Union, we have one perspective, but the world is really big. So we should keep in mind that there are other regulations, other perspectives. So for example, the US adopts other kind of regulation, but in this topic, I will use only the European Union one. First of all, when we have to process data, we should keep in mind that this kind of data can be personal data, meaning a data that can be associated to a natural person. This natural person can be identified by this data. Think about the name, the surname, the address, the email address of a natural person, or non-personal data. Not all the data that are processed by digital services, products, during a scientific project are personal data. There is also the possibility that a scientific project uses non-personal data. And when a scientific project does not process personal data, the data protection regime is out of the scope. So we are free from the boundaries of, for example, the General Data Protection Regulation, the GDPR. In fact, there is a specific type of non-personal data that is anonymous data that is out of the European Union data protection framework. And when we have anonymous data, we can process this data without specific safeguards and without specific boundaries. However, we should keep in mind that not all the anonymous data may be anonymous from the beginning, but we also have the possibility to process in a first point personal data and then move to anonymized data that are data before related to a natural person, and after a process of anonymization, this data becomes no more related to a natural person. In this second step, then we can move out to the legal boundaries and process this data without the obligations provided by the data protection framework. The scientific research needs to process health data are strictly related to another important concept, that is the health data concept. We should be aware that in the data protection framework, actually, we have another similar term that is data concerning health, that is broader than the concept of health data. In fact, we may have health data not only on, for example, data about cardiology test, or data about the pregnancy test, or other kind of typical clinical data. In fact, data concerning health is a more broader concept that can include also, for example, data related to habits. For example, the fact that I cannot eat some specific food, or that I smoke. This kind of data may be considered data concerning health. Therefore, we should keep in mind that the data protection framework requires specific safeguards for this particular category of data that is considered sensitive for a person. In the end, we should also keep in mind the difference between the concept of data controller you saw just before in the Zoom presentation of Vittorio, that we have the notion of data controller, the university that is processing our data via Zoom now, but in the debate that nowadays is really spread out for all these strategies on data, on open science, people are using other concepts, for example, data owner or data holder, that may be not identical, and there may be not a correspondence between a data controller, that is a person, natural or legal person, that process personal data by finding the purpose and the means for the processing. And on the other hand, the data owner, that may be a natural or legal person that has the control over data. Maybe because he or she has created a database, or he or she is legal institutions, or a company that has created data, or has received data from another institution or company. So the use of personal health data, meaning data concerning health in a broad definition for scientific research purposes, should comply in general with the data protection framework. But as the third speaker will explain, there should be also an important focus on the ethical issues that has to be kept in mind, because the processing of personal health data is also connected to other rights and freedoms of data subjects, so the individuals whose data are processed. On the one hand, we have the need to protect the right to data protection and to ensure that fundamental rights and freedoms of data subjects are guaranteed. But on the other hand, we need to open data in light of the open science paradigm, and also in light of the need to foster scientific research and scientific progress. And we have to keep in mind that the pandemic and the COVID-19 need for vaccines, and so all these last 2 years has shown that we need to open the access to medical data, to clinical data, to health data, also for public health purposes, and also to foster innovation that is really important for not only a state, a member state, or a particular national framework, but for all over the world needs. And so we have to find some specific regulatory models that combine the need to apply and comply with the data protection regime, but at the same time to move in concrete to foster the open science and open data policies that in the last years have only been promoted at high level, or also at universities in some contexts, but maybe they have just remained only words in the last year. So moving to the data protection framework, we can say that when processing personal data, meaning when collecting, storing, sending, making available personal data, we have to keep in mind at least three legislation. First of all, the General Data Protection Regulation at EU level, but there is also a regulation for the institution and bodies at EU level. And when a scientific project uses, for example, telecommunication data and other personal data related to the communication, think about cookies and other specific categories of data, we should also keep in mind the e-privacy directive. As regards the GDPR, we should focus on some specific, but at the same time, general concepts. First of all, when we process personal data, we should process personal data only for a specific purpose. So we should find a purpose for processing personal data, meaning that in a scientific project, we can use data coming from another processing. Think about a project that uses images, health images coming from an hospital or coming from a private database. In this case, we have a primary purpose, that is the purpose in the processing between the data collector, the data controller, that, for example, the hospital that has collected the data from me, from the natural person, from the patient, for the purpose of providing healthcare. That is the primary purpose for the processing. At the same time, the hospital and a research institution want to use this data for a scientific project in the healthcare domain for medical goals. Therefore, we have a secondary purpose, this new purpose on processing data for scientific reasons. The GDPR asks to the data controller and to all the roles involved in data processing on defining and specifying in a strict way the purpose for the activities. This implies that when we have to write the program of the scientific project, we have to specify deeply and in detail the purpose for the processing. And we should keep in mind whether the purpose is a primary purpose. So as a research institution, I'm collecting the health data for the scientific project. I'm a primary processing, or whether I'm asking this data to another institution and am I carrying out a secondary processing. The difference creates a different system of rules and obligations. Second important concept, we should keep in mind that when we process personal data, we should have a legal ground, meaning we should have a legal base that justify that we are processing the personal data. For example, when we apply or when we use a social network service, we are asked for providing the consent. This is one of the possible legal grounds, but in general, there will be other possibilities. And as I will show you in a minute, for the scientific research context, there will be at least two more legal grounds to be used. I told before that the category of data concerning health is a particular category of data, and the GDPR asks for specific safeguards when particular sensitive data are processed. And in the end, we should keep in mind that the GDPR provides other important principles. The first one is accountability. The need that the data controller should prove to be compliant with the law, should create the documents, should create an audit system, as the second speaker will explain, a data management plan to prove that he or she is compliant with the regulation. The other two important principles in the scientific research context are on the one hand, the data minimization principle that requires to limit the quantity of personal data processed only in relation to the need, so only in relation to the purpose. And on the other hand, the storage limitation principles that implies the time, creating a specific time to store the data, and after that period of time, the data should be deleted. When we carry out a scientific project, in the medical domain, we should also remember that the data subjects have specific data protection rights. And in this concept, we should, first of all, provide an information policy, a privacy policy, because the data subject has the right to receive information on the processing of the activities that we are performing in a project. He or she has also the right to access to the information about the processing and about the data that are processed in the project. And eventually he or she may also have the right to withdraw the consent and ask for the erasure of the data. Therefore, the data controller, the data processor that processes the data on behalf of the controller, for example, the particular unit in a research lab, or an external institution and company that helps with the data processing, should comply with other specific obligations in the GDPR framework that are, first of all, the data protection by design requirement that asks to the data controller to implement organizational and technical measures to comply with the obligations in general of the GDPR. And so implementing organizational and technical measures that safeguards and protect the data used in the data processing. The security obligation that asks to secure and protect the confidentiality and the integrity of the personal data process, and in the end, the need, in some cases, to perform the so-called data protection impact assessment, that is an assessment related to the risk of the data processing. The GDPR, in general, we can say that as a favor for the scientific research domain, since it provides some exceptions to the principles and the obligations that I've just mentioned in the last minutes. So, for example, as regards the purpose limitation principles, the GDPR states that the processing for scientific research purposes is compatible with the primary processing, meaning that we can process personal data for scientific research processing purposes without asking for compatibility, legal compatibility of the primary purpose. What does it mean? That an hospital, for example, can process the data collected for the healthcare purposes in a second step for scientific research purposes without asking for the need to limit the second processing in light of the purpose limitation principles. But at the same time, there should be found a legal ground, for example, the consent or other legal grounds to justify the second processing. The GDPR also provides some derogations to the duty of inform the data subject when it is impossible to inform the data subject about the scientific research processing. And in the case of health data concerning health, the regulation provides also an exception that allows the data processing without the explicit consent of the data subject, but the GDPR leaves the implementation and leaves to the member states to provide more measures and safeguards that allow this exception. What I'm saying that the GDPR allows the processing of data concerning health for scientific reasons, but at the same time asks to the member state to provide more safeguards and more guarantees that should be implemented at national level to guarantee that on the one hand, we can have scientific research purposes, processing, but on the other hand, we safeguard the rights of the data subject. And this is a problem. In fact, the European Data Protection Supervisor, the authority, the main data protection authority at EU level, was asked to provide some guidance because on the one hand, as I've shown, the GDPR allows the processing for scientific reasons, but on the other hand, asks to find a legal ground, to find some measures, to find some safeguards at national level. And when we have a scientific project, maybe we are not so prepared to find a specific legal ground to explain all the measures that have been implemented. And the EDPB explained in 2020 that actually, yes, the GDPR provides room for processing data for scientific reasons, but at the same time, all the roles involved in the data processing, so the data controller mainly, should find a legal ground, and the first legal ground should be the consent of the data subject. So we should ask the consent for the data subject for processing his or her personal data. At the same time, this consent should be informed, specific, and freely given, meaning should be very, very, very hard to ask to the data subject the permission for processing his or her data for a scientific project. In fact, the so-called notion of broad consent is not allowed in the data protection framework. We may eventually ask to the data subject the permission for processing in specific areas of scientific research. So we may ask for processing data for not so specific scientific project, but for example, an areas of project, of scientific project. But at the same time, we should rely on informed consent. So we should specify in the information, in the privacy policy, what we are doing with his or her data in a scientific project. As I told before, the consent is not the only possible legal ground. In fact, we can have also the public interest or the legitimate interest ground. And in the case of a university, a research institution as a university, we can rely on this kind of ground because we can show that in the interest of the university, there is performing research projects. But we are now still waiting for a final opinion by the European Data Protection Supervisor and the European Data Protection Board that explains what areas of research means for the data processing in the scientific research domain. Before, I just briefly explained that the data protection framework is, of course, highly covered at EU level with the GDPR and with the other EU regulations and directive, but the GDPR leaves to the member state the possibility to further provide rules to safeguard the right to data protection. And in Italy, we have the Data Protection Code, Codice in materia della protezione dei dati personali, that establishes 2 specific articles, so provisions, on the medical, biomedical, and epidemiological fields. So on scientific research including health data, for example, or other particularly and sensitive personal data. In Italy, we can perform a scientific project relying on the exceptions of the GDPR. So, for example, Article 9 of the GDPR, paragraph 2, letter J, that allows the data processing for scientific purposes. But we should also ask for the concept of the data subject in general. So this is the basic rule, the default rule. And only when other conditions apply, we can not ask to the data subject the consenting for the data processing, and we can process and perform the scientific project without the consent of the data subject. I will not bother you with all the condition. I just put the condition on the slide, but I just want to show that there are more possibilities in Italy for not asking the consent to the data subject. And so, for example, for the university or for the group that want to process personal data, can try to use some exceptions and some conditions of the data protection code in order to avoid the need to collect the consent of the data subject, especially in the big data context. In France, the situation is slightly different, because the consent is just one of the possibilities, and we have the great help of the CNIL, the Commission Nationale de l'Informatique et des Libertés, that provides guidance for the scientific research purposes, and allows, by a combination of a system of authorization, national authorization, and national and local ethical committees, allows the research groups to process personal data without asking for the consent of the data subject. So now we move to the open science regime. The GDPR is just one piece of the puzzle in the legal framework that is related to the scientific research context. We want to promote open science. We want to promote also the open data, the open access, all the open policies that fosters innovation and foster the scientific progress. And we can find a new definition of open science in the last regulation of the Framework for Program for Research and Innovation of the European Union in the context of Horizon Europe programs, that explains that the open science means an approach to the scientific process based on cooperative tools, the tools and infusion of knowledge, and that includes some specific elements. One of these elements is the open access to research data. But what are research data? We can look at the definition that is provided by a recommendation on open science at international level, that explains that open research data can include digital and analog data, not only personal data, but also raw and process data. It includes images, sounds, protocols, as you may see here in the definition, and as the more important element, open research data allows data to be used, so a primary processing, but also to be reused, so a secondary and other processing, more and more steps without a limitation. Not only using and reusing, but also retaining and redistributing data. This means storing data and sending data, making available data to third parties, third institutions, and also redistributing by anyone. So not just the role of a data controller or a data processor. So for example, one group to another scientific group, but all of us, all can access to this data for whatever purpose we have. Moreover, open data, open research data should have some characteristics. It should be available in a timely and user-friendly form, a human and machine-readable format. So not only a human, but also the machine, the algorithms can have access, but also can understand and read the data. And in the end, open research data should be fair. I know that the second speaker will explain maybe better the fair principles, but in general, we can say that these principles imply that data should be findable, accessible, interoperable, and usable. So there should be a good data management, and data should be accurate and should be in a good quality, should be shareable and usable. But fair principles only mean that data have such a characteristic to be findable, accessible, and interoperable, not that data are open data. What I'm saying that we have on the one hand open data, and on the other hand we have open data that are fair. If we have fair data, this does not mean that we have at the same time open data. In fact, fair data is not directly open data and quality data. So, to sum up, open data can be fair, but fair data are not always open. In fact, in general, open data are only ensured in some specific legal frameworks. And in fact, the legislative acts on open data are mainly devoted to the so-called public sector information context. In fact, we have at EU level an important open data directive of 2019 that applies to the public sector bodies and to the public sector information and not to the private sector context, to the private sector information. This directive allows the use of open data in the scientific research context, and it provides a definition of the research data that is documents in a digital form other than scientific publications that are instead related to open access, so not to open data, which are collected or produced in the course of the scientific research activities and are used as evidence in the research process. However, the Open Data Directive is limited to, as you may see in Article 10, to publicly funded research. In fact, paragraph 1 of this article is referring only to the so-called research under the open access policy, and only in the context of public sector information. This article is really important because it provides the so-called principle of open by default that asks to the public sector bodies to open by default the collected data. And it refers for the first time to the, in a hard law, to the other concept well known in the open science paradigm, that is as open as possible, as close as necessary. On the basis of this provision that has been and should be implemented at national level by member states, we can say that national member states in the European Union should adopt policies for data sharing and reuse of research data in light of the definition of the previous slide, so we will have national transpositions of the Open Data Directive and less harmonization because it is just a directive and not a regulation. But however, it is a positive piece of legislation because it mandates the adoption of policies for open data and for data sharing and reuse. These policies should be directed surely to public bodies that fund and conduct public scientific research. And these policies should include the open by design and by default principles that require that the data should be free of charge, but also should be open, always open. Not always, but at the same time, data should be limited when the openness should be limited when other rights and freedoms are in place. And so we have some possible pre-existing limits to the open data regime that are, first of all, the intellectual property rights. So think about patents, trademarks, and other, for example, legitimate commercial interests, so trade secrets, know-how, etc. And the privacy and data protection legal framework. So the Open Data Directive mandates to the member state the implementation of policies for fostering open data and fostering data sharing and data reuse, but at the same time, the same directive protects and limits the application of these policies when specific limitations are in place. And this specific limitation is data protection, privacy, confidentiality, the need of national security, the protection of national security, and the possibility that on the open data, insist intellectual property rights. However, when these limitations are not in place, the data should be open, and when possible, data should be made available under open licenses, for example, the CC licenses. As I mentioned before, the Open Data Directive has been implemented at national level, also, for example, in Italy. We have in these two pieces of legislations a new definition of research data and data sharing. So if you want to use the open data narrative in Italy, we should look at these two important pieces of legislations. But we also have at a national level, June 15, last week, the new national plan on open science that included on the research data some specific policies and initiatives that should be promoted in the next years. The government explained in the national plan that we should foster the verification of the open data, so trying to combine the separate notion of open data and fair data. We should integrate into the European Open Science Cloud that I will explain in a minute. It is an important initiative at EU level. And we should also hire some at national level training and hire technical figures, technical persons that, for example, data scientists, data stewards that can collaborate at national level for fostering open science and open data, and the government explained that they will create an Italian computing and data infrastructure that will foster the access to open data. I will just quickly finish with some reference to the new proposals at EU level that may foster open science and open data. We have two important proposals. This one is the Data Governance Act of 2020 that creates some condition for the reuse of personal and non-personal data that are under the control, once again, of public sector bodies. And then, this proposal includes a famous concept that is data altruism. And then we have that allows the sharing of data under the permission of the data subject or the data holder. And we have also another proposal, a really recent proposal, the so-called Data Act, that is dedicated to the private sector, and so to the data generated by the use of products and other services. It refers to personal and non-personal data, but also it creates some condition for opening the concept of open data, not only to the e-government and public context, but also to the private sector. In fact, all these strategies of the European Union in the last years and all the projects to create, for example, a digital single market strategy for data and for fostering a free flow of data, but also for creating a European open science cloud, is trying to cover not only the public sector bodies, but also the private sector, under the principle that I mentioned before, as open as possible, as close as necessary. I just want to underline that in the health context and the e-health context, we have a recent proposal for a regulation for creating an European health data space that is not directly dedicated to the scientific research domain, because it refers to the data sharing and reuse of data for the primary healthcare purpose. So between, for example, an hospital in Italy and an hospital in Luxembourg for providing healthcare to me that I am in Luxembourg, but I am Italian. But at the same time, this new space will create some grounds for fostering research, and maybe in the future for create a European Union database of health data that can be used for scientific purposes. In fact, for example, in the European Open Science Cloud website, we can now see that there are some open access databases that include health data. This is just one example. And so I think that in the future, there will be more connection to databases and to have access and then reuse health data and data concerning health. I'm concluding. It is clear that there will be a contrast between I see some messages. No, just for the question. Okay, there will be some tension and contrast between, on the one hand, the need to share data, to reuse data under the open data and open science paradigms, and on the other hand, the need to control the data processing, to be compliant with the GDPR obligations, to safeguard the rights of the data subject. And in fact, there are some specific tensions between these two regimes. The need to find a legal basis is in contrast with the unlimited access and openness of the open data and open science paradigm. If we have an open database, we cannot find a legal basis. Therefore, we should find a strategy to open the data, but at the same time to have a legal basis, for example, a public interest on conducting the research. Another important limit to open the data is the need to find a purpose, a specific purpose. As I told you before, the GDPR asks for the respect of the purpose limitation principles, but in the context of open data, we want to have unlimited use and to not find before a purpose. And this is a really big problem that I think that the European Data Protection Supervisor will address in the new opinion that was expected in June 2022, but I think before December will be published in its website. If we want to go out to the data protection regime, we should anonymize data. But at the same time, in the scientific research context, sometimes we just want to have pseudonymized data, and we want personal data because the personal data in the medical domain especially is rich and can create association that can train, for example, the algorithms of the scientific project better than having just anonymized data or anonymous data. During this presentation, I just mentioned the intellectual property field, but we should also keep in mind that when we open the data, we have the limits of the intellectual property field, and on this data, that despite the fact that data should not be protected by intellectual property because data is just information, it's just a fact, and it is not a good, we may have on the database of the data or on the collection of the data some rights by third parties. We may have patents, we may have copyrights, other specific related rights, so for example, data exclusivity or trademarks. And so we should remember that there will be not just the problem of the data protection regime, but also the problem of the data-related protection, so the IP rights. And we should find existing and useful models for the data management, as the second speaker will introduce. And we should also keep in mind that the GDPR and in general the data protection framework provides some room for creating on a case-by-case basis solutions for processing personal health data, but also opening and accessing to this data for scientific reasons in light of the data protection by design principle. And so we should look at the new strategies and the new rules for the next future, trying to combine on the one hand the need to close a little bit the accessibility and at the same time trying to open the data with reasonable approaches for the scientific reasons. So thank you. I will share my presentation with some references and the possibility to ask for other further explanations.
Thanks, Giorgia. I think we should have time for a few questions. I think we can later on maybe cut the breaks and the final discussion. We have time. I think I've seen Carlo Minucci booking a place for questions, and also Doreen, she raised her hands.
Okay, thank you, Giorgia, for your very interesting presentation. What you said about clinical data, I think it's very important for clinicians and scientists, because I don't think it's very clear at the moment what one can do or cannot. Obviously, there are all the official documents around, but I was wondering is there a document that brings together this aspect of reusing data for a secondary purpose in clinical research? I'm referring to a simple document, a document where it's explained what can be done and how it can be done. Because I think it's very, very important moment to have this kind of clarity on this aspect.
So there is no such a document at EU level, and we are expecting the new opinion by the Data Protection Authority that should cover the clinical domain. But there is a literature by academic scholar that is trying to find some guidelines in this domain. And for example, in the work that I'm doing at the Faculty of Law in convention with Fondazione Bruno Kessler and also the local healthcare provider, azienda sanitaria azienda per I servizi sociosanitari here in Trento, we are trying to create some we call it patto col cittadino, that are strategies and solutions that will foster the reuse of the health data, the clinical data collected by the healthcare provider for scientific reasons and for example, the project of Fondazione Bruno Kessler. So I can share with you some working documents and some reports that we are writing, but I think that the problem here is the need to find on a case-by-case basis the solutions for the specific scientific project. For example, if one of the projects carried out at CIMEC is covered by the National Health Plan, so for example, the research should be a research ricerca finalizzata, finalized research at national level, then we have one solution for reusing data. If this research is not covered by the national plan, that we should have another one. So, but I think that I can send you some documents, and then I can also write a paper that summarize all the findings and maybe trying to give some existing ways, classifying some existing way for the reuse.
Thank you, because I think it's very important, even at the national level, to have a sort of open document that can be updated with different opinion over time. So it can be sort of reference, a framework that can be used, at least at national level, to have a little bit of more clarity on this subject. So yes, as Enrico is suggesting, if you write a paper, that will be perfect.